talk about the promise versus the reality of the $2,000 out-of-pocket cap on covered Part D prescription drugs. Starting in 2025, Medicare Part D beneficiaries are seeing something they've never seen before, and that's a hard cap on annual out-of-pocket prescription costs. No matter how expensive their medications, spending will stop at $2,000 per year for covered drugs. On paper, this looks like the most consumer-friendly change in the program's nearly 20-year history. There were really three goals that the government had in mind in putting in this Part D cap. The first is predictability. For the first time, beneficiaries know their worst-case scenario up front. There's no more open-ended exposure to thousands of dollars in drug costs. Second, it provides relief for high-cost users. Seniors who take costly specialty drugs could save thousands. Someone spending $8,000 annually on prescriptions, for instance, will now stop paying after $2,000 as long as their prescriptions are covered by the drug plan. And it can lead to better adherence to medication schedules. With less fear of catastrophic drug bills, more people are likely to stay on their medications instead of rationing or skipping doses. But in healthcare, there is no such thing as a free lunch. And to cover the cost of this added protection, carriers are already responding in ways that may lessen the benefit. Premium increases, for instance. In 2025, some standalone Part D plans raised their monthly premiums by up to $35, which was the maximum increase allowed under the new premium stabilization demonstration. In 2026, though, that cap grows higher, with increases of up to $50 per month expected for some plans. And this is causing the base premium to trend upwards. The Part D base beneficiary premium, which is the benchmark tied to overall program costs, will rise from $36.78 in 2025 to $38.99 in 2026, which is roughly a 6% jump in just 1 year. And that's leading to affordability concerns. For nearly 2 decades, Part D premiums stayed relatively stable. Now, with larger allowable increases, some plans have doubled in cost within a single year. That's a dramatic shift for seniors on fixed incomes. And there's other cost shifting as well. Deductibles are rising from $590 in 2025 to $615 in 2026. And many carriers are trimming formularies or shifting drugs to higher cost tiers, which means consumers may pay more out of pocket even before hitting the cap. The bottom line here is that while the $2,000 cap offers meaningful protection for those with the highest drug costs, it also signals the end of an unusually stable era in Part D pricing. For many beneficiaries, the trade-off may feel less like a win and more like a reshuffling of costs. And for employers, this richer Part D benefit means the bar for creditable coverage is moving higher and the calculations are about to get more complex.